Asthma is a chronic lung disease that inflames and narrows the airways. Asthma affects people of all ages, but it most often starts during childhood. Asthma is a no-cure disease. However, it can be controlled with a good treatment. Because asthma often changes over time, it is important that patients work with doctors to track their signs and symptoms and adjust treatment as needed. The exact cause of asthma isn't known. However, individuals who most likely develop asthma include those considered to have a genetic predisposition to developing hypersensitivities. In other words, researchers think some genetic and environmental factors interact to cause asthma. The treatment of asthma can be as simple as reducing the amount of physical activity you do daily in order to avoid shortness of breath, while a more intensive option is an inhaler with beta-2. This drug can save lives along with anti-inflammatory drugs, and particularly inhaled steroids. They are able to react immediately to asthma that can be brought on quickly due to the environment, allergies, and activities. Being aware of triggers and watching for them can prevent serious asthma attacks. Whether it is seasonal asthma that an individual is suffering from, or from a viral infection, there are options that are viable. Asthma is a disease that has no cure and affects a huge population globally. It is common for individuals to be diagnosed in early childhood, even though it can affect all age groups. It is believed by many that asthma is something that everyone eventually grows out of, but only a few truly experience symptom loss. However, the majority experience milder symptoms as they age or with strenuous activity become more aggressive. The goal of the patients and their doctors is to implement a control plan so they can tolerate day-to-day functioning as normal as possible. Since the child is around their parents the majority of the time, it is important to know that some strategies that should be taken to help your child prepare them in case symptoms are shown. Looking at your home and the environment that your child is in can be very helpful to see if there are any triggers out there that pose a threat. Making sure there are the appropriate medicines handy for the child is a great strategy as well, so that can mean making sure the pharmacy lets the child pick up their own medicine if they are of age. This way, the child will know how to go about refilling their prescription and picking it up. Also, scheduling regular visits with your primary doctor is beneficial to both the parent and child just to see how everything is going and/or if any immediate actions need to be taken. For a teacher, it may be harder to prevent asthma attacks in the classroom since there are many students to worry about, but educating the classroom about this disease may be helpful. This way, some students know different methods to go about in the classroom to eliminate triggers and to be mindful of their peers. Planning asthma-friendly activities and field trips would be greatly appreciated for the students that do have asthma, because that would mean they wouldn't have to stay at home while their peers are on a field trip or participating in an activity that would not be safe for a child with asthma. Some of our references include Baptist Health, Children's Hospital, and the National Center for Biotechnology Information.